Well, hello everybody. John Robinson, aka the Hospice Guy. Today is day 4 of my 30-day video program about hospice. You know, November is National Hospice and Palliative Care Month. And I've been covering so far some of the major aspects of hospice. Now I'm going to get into a little more meat of the subject. This is so very important to me, this part that we're going to talk about today. First of all, I want to talk about pain medications such as Oxycontin, MS-Contin, morphine, medications such as that to control your pain when you are on your end-of-life journey. There's 2 words that I need to describe first of all. And I put these together, these definitions of these 2 words. Tolerance versus addiction. Tolerance is the decreased capacity to effectively absorb a drug after prolonged use. As opposed to addiction, a psychological need or dependency or compulsive abuse of a controlled substance. You know, I need to be brutally honest with you at this particular time. When a person is placed on morphine or any type of pain medication or any drug for shortness of breath when they're at the end of their life, you know, according to day number 1, and the doctor says within 6 months if your disease process, etc., etc. Well, I can guarantee you that if your prognosis is 6 months or less, you will not become addicted to morphine or Oxycontin or MS-Contin. You are treating a symptom. Just as much as I could say to you, if you have congestive heart failure and you take digoxin and you take potassium, or if you're a diabetic and you take insulin, or you take one of the newer medications that controls that disease process or its symptoms, are you addicted to that? You need those medications to maintain a normal life, a normal health. It's the same thing with pain medication with a hospice patient. You are controlling a symptom. And when people say to me, you know what, please don't over-medicate my father, I don't want you killing him with medication. Well, at this point in a person's life, it's the disease that is going to cause the person to pass. You know, I confront this every day, and I have this argument with my wife often, or we talk about this with patients and their families. Just please, it's the disease. These people are at the end of their lives. Whether you give them pain medication or not, that day is going to come. And if you were at the end of your life, would you want to be lying in that bed in pain, being uncomfortable, being short of breath? Or would you rather be comfortable and peaceful, at rest? So that's one thing, please folks. Once again, tolerance versus addiction. You know, I've had patients that I've increased their pain medications every week because their disease process progresses to a point where what I was giving them a week ago just does not hold them. So that's strangely different than addiction. So please remember, addiction is used for fun. It's used for getting high. It's for abusing. My patients do not abuse morphine, Oxycontin, those type of medications. So with that being said, I just wanted to get that out there and let you folks know that. And this is what I've seen in 16 years of being a hospice nurse. So please, don't hesitate to take your pain medications. You know, there's no need to suffer needlessly or to allow somebody to suffer needlessly. You know, my name's John Robinson, aka the Hospice Guy. May everybody have a blessed and great evening. Good day.